When her son Ibrahim was born 6 years ago, MASTURA thought living in Sudan's capital Khartoum would make it easy to get medical help. He suffers from brain damage sustained at birth, as well as malnutrition and anemia. His eldest sister had malaria and jaundice and died after being diagnosed late. And MASTURA fears that with treatment being so expensive, Ibrahim could suffer the same fate.
His medicines cost so much that sometimes I don't get them all. But if I miss a single one, then within hours he starts getting convulsions and has to be hospitalized. The hospitals are free, but the treatment costs money, which I don't always have. It's mostly people who take pity on me and contribute.
MASTURA says she has to travel more than 15 kilometers to take her son to a hospital doctor. According to the World Health Organization, more than 35% of Sudan's population of 40 million people live in areas far from adequate health facilities. That's because years of conflict have destroyed health facilities in many areas. War and 20 years of U.S. economic sanctions have also depleted government funds, and less than 10% is directed to healthcare. For many, the only way to get treatment is by coming to the capital. But doctors there say even then, it can't be guaranteed.
The hospital lacks proper equipment and doesn't have enough beds. Most are in need of rehabilitation because they were built during colonial times. Then there's the issue of manpower. We don't have enough doctors in government hospitals because the pay isn't enough, so most prefer to either go to private practice or leave the country.
Problems facing health services are not recent. Difficulty in getting health care contributed to nationwide protests last year against the government. And since a new transitional government took over in August, the country has been suffering epidemics like malaria, cholera and dengue fever, affecting thousands of people. So getting treatment has become even more important. Since September, at least 300 cases of cholera have been reported, including 10 fatalities. And in early November, more than 90 people suffering dengue fever were received daily in hospitals in the eastern state of Kassala. Aid organizations say most of those infected are children, and more than 2 million suffer from malnutrition.
It's in the service side where there is an access issue, there is lack of services, there's lack of funding for the services that the community need, but also there is a perception, there is understanding, there is a community willingness to be with us in the same platform so that we can work, whether it's, as you said, immunization for polio, other kind of vaccine, cholera vaccine.
MASTURA says that she can't always afford to feed Ibrahim properly, but she says she hopes Sudan's new government will improve health care so he and her other children can get the medical care they need. Hiba, Al Jazeera, Khartoum.